equity, and inclusion.
Thank you, Frank. So Frank is being very modest as it relates to, how we work together. Before joining Jefferson, I worked with RWJ Barnabas Health, and I was a part of the diversity team with Frank and Paula Gutierrez, my fellow panelists on this journey and all. So as a part of the RWJ family, I say, hi, everybody, miss you a lot. But I was fortunate to be offered an opportunity in Philadelphia to be a part of the Diversity Enterprise Office of Diversity, Inclusion, and Community Engagement for Thomas Jefferson University and Jefferson Health. So we're very comparable in size to RWJBH. We're about 35,000 employees, 13 acute hospitals, a bunch of physician practices, and so forth. So fairly straightforward. On the university side, we have about 12 colleges. So we have our medical school, we have other colleges. We purchased the Philadelphia Textiles University. So we've got business programs, fashion design, if any of you are interested as a minor in your studies at Rutgers. But anyway, so the organization is going through what I call a reimagined focus on diversity and inclusion. And so I was brought in to help realize that. And I have been a career HR practitioner. So any of you that are coming up through the HR arena in master's programs, I've been in HR since I was 5 and multiple disciplines within HR, but I can say that I've been doing diversity and inclusion probably ever since I was 6 years old. And that was my first time that I actually realized the gravity of difference between race. And from that point forward, I knew that everything I had to do, I had to figure out how to relationship build, which is the foundation skill for this work, to enable to get along, just to live, to assimilate, to function, to grow and develop. Everything starts with, relationship building. And that was my very first experience of understanding I have to learn how to meet people where they need to be met in order to survive.
Well, thank you so much, Brenda, for this introduction. And certainly, we look forward. We thank you for being part of the panel, and we certainly look forward to gaining your insights and really having an engaging conversation. One key aspect when it comes to diversity, equity, and inclusion, I always like to mention is that work is really trifold, particularly when it comes to healthcare. I think that what differentiates diversity and inclusion in healthcare is really the focus on health equity. And I think that, so Paula Gutierrez, in fact, is really a key leader in having adopted various models within our RWJ Barnabas Health, particularly at Rutgers University Hospital in Somerset, and having really being the first hospital to have an LGBTQ focused initiative and really having the Proud Health Center in the state of New Jersey. So I'd like to introduce Paula Gutierrez, who's a director of diversity and inclusion at Rutgers University Hospital in Somerset. She's an esteemed colleague. She's no stranger to Rutgers University, and truly a joy to work with, and is in fact has spearheaded the efforts at the Proud Family Health Center, and really has been a major contributor in ensuring that we're on a journey towards health equity. So Paula, please tell us about your background, how you got into diversity, equity, and inclusion, and more importantly, just some of the key initiatives that you're currently working on.
Frank, thank you so much. Thank you, Nasi and Rutgers University, for the invitation. Wendell, Frank, and others, a lot of familiar faces. Brenda, of course, always a pleasure to see you, and we certainly miss you. As Frank said, really a lot of my career really has been from a health equity lens. And I was actually having a conversation with a colleague who's out on the West Coast, and I said to him, I feel like I've been doing this work before it was the cool thing to do. And much like Brenda, who realized, early on in her age, really, and I think for a lot of us, it resonates at an early age that we realize that we're a little bit different than other people, and there's sort of this very innate responsibility to contribute to that and bridging a lot of those barriers and gaps that we face as people of color. I'm first generation American. My parents are from Colombia. I'm Latina, very proud of it. And, English was not my first language. I learned to speak Spanish much before I learned English. And that is where I realized, again, very early on at the age of 5, that I wasn't like everybody else, right? So, I had sort of a front row seat in terms of the inequities that I saw with my own family and my community where I grew up. I grew up in northern New Jersey, predominantly Hispanic neighborhood, where a lot of the inequities that we saw were healthcare related. And I was often called upon to bridge that gap, whether it was language barrier or just from a medical perspective. So it really sort of became, for me, my personal mission to figure out a way for me to bridge those gaps and try to break down some of those barriers that my very own community was facing. So most of my career I spent doing nonprofit work in transplant and organ donation, where, of course, if you know anything about transplant and donation, there's a big disparity there when it comes to communities of color. So, again, much like my upbringing, I had a front row seat with that and figuring out a way, whether it was through creating policies, creating procedures that would address ensuring that minorities and people that needed access to a transplant were doing that. So I spent some time doing nonprofit work and then transitioned to work at New York Presbyterian, where I was the administrator for liver and kidney transplant for a bit. And then kind of as I developed in those roles, there was still something for me that was missing, and trying to find an opportunity where I could still have a voice, try to have a voice for the people that were marginalized. And that's sort of where diversity and inclusion kind of came to be. The opportunity to join the Somerset team happened. And it's been incredibly rewarding, very rewarding journey. One of the things that Frank alluded to was the work that I do also for the LGBTQ plus community. We think of so many intersectionalities that exist from not just a race and ethnicity perspective and gender, but also when it comes to sexual orientation and gender identity. So for me, my work in DEI has been about serving and not necessarily looking at who I'm serving, but serving those that need it the most. And there's been an opportunity at RWJ. We've developed the BAPSIT Pristine Proud Center, which is New Jersey's first LGBTQ healthcare facility. Oftentimes people ask, well, why does the LGBTQ plus community need, their own center? And, we could spend a whole hour just talking about that. Another community that's been very marginalized, discriminated in so many ways, especially when it comes to healthcare. So for us to be able to have a safe space, a culturally competent and welcoming space where individuals are affirmed in the way that they identify, is very humbling. And it's, we do great work. And I always say to my team, I get to sit here and talk about it, but it's really them that are doing the work day in and day out, seeing our patients. So, a bulk of what I do on a day-to-day basis is very focused on the LGBTQ plus community.
Incredible. Thank you so much, Paula. As you can see, I think the MHA students will definitely enjoy having a lot of questions for you, particularly at the end of our dialogue. And I'd like to let everyone know that we will leave some time, about 20 minutes later in our panel, to ensure that you all have an opportunity to ask any questions that you may have. And so certainly, last but not least, we have Adele Wilson, who truly is a star. And she doesn't recall actually meeting me a couple of years ago, but I remember meeting her at the corporate at RWJ Barnabas Health in West Orange, and who has been truly, just her energy and enthusiasm and the work that she's doing has been truly impeccable. She's a best-selling author. She's the CEO of her company, her own company, Celebrity Media Group. And it's truly an honor to have Adele Wilson be part of our panel today. Adele, I'd like for you to just take some time and just tell us a little bit about your journey. We would definitely like to certainly leverage your diverse experience as a leader, as a woman in business, and certainly any tips and advice that you may have for young leaders that are currently part of our panel today to, in fact, embark on a journey to be successful regardless of their path, regardless of their industry.
Absolutely. Well, thank you, Frank. I actually do remember. I do remember. And first I wanted to thank you for having me, as well as Wendell, Nase, and Rutgers University for having me. And it's an honor to be on a panel with Brenda Snipes, as well as Paula Gutierrez. And it's just a pleasure. I am, as Frank had mentioned, I do have my own company. It is called Celebrity Media Group. And what I do is I help entrepreneurs and professionals present with power, poise, and style on camera, get booked on TV and media, and become a celebrity or a thought leader in their industry so that they can elevate their brand, grow their business, attract better quality clients or patients, depending upon what area they're in. And I am an Afro-Latina. I have a lot of similarities with Paula, with your story, Paula. When you were mentioning it, I was thinking we have very similar journey. I am first generation American, and my parents were both immigrated here from the Dominican Republic. My father was one of the first Dominican physicians in the country, and he started his first practice in New York City, and my mom opened the practice with him. So I kind of come from a healthcare family, but I've had an unorthodox journey, if you will. And I'll talk a little bit about my journey in healthcare, but it is mostly in the corporate training space. Once I graduated from NYU in Columbia, I started working for a corporate training company. And I mainly did teach on soft skills, so communication skills, public speaking, presentation skills, media training, team building, that sort of thing. But I wound up teaching about 50 different subjects, even though I had a specialty of about 5, and those are some of the soft skills I would train to. But also every once in a while, they would send me to teach. I would facilitate courses on cultural diversity. And I did so a lot within the healthcare sector. In fact, Jersey City Medical Center, before it became part of RWJ, was one of our clients. Meadowlands Medical Center, a lot in other healthcare industries as well as nursing homes, rehabilitation centers. And after that, I moved on. I worked as a corporate trainer for about 7 years. And then I moved on to working for a health system, which is where I met my friend Wendell. And we worked for a health system in New York City, and an academic, one of the top academic institutions and medical centers. And I worked as a physician relations manager and outreach manager. So lots of marketing and promotional activities. I ran continuing medical education programs and conferences, national ones as well as local, and worked very closely within cardiology and our cardiovascular department. And I also worked in pharma. My second book actually is on breaking into the pharmaceutical sales business. So feel free to pick that up on Amazon. I think it's a great book to help folks that are looking to get into any arena within healthcare, especially healthcare sales. And it's a really quick read. It's a good kind of preparation for an interview. So it's called Pharma Success Secrets. And then I have my latest book, Celebrity Media Secrets, 7 Simple Steps to Present with Power, Poise, and Style on Camera, get booked on TV and media, and become a celebrity in your industry. That's my story.
Incredible.
Born and raised in Bergen County, if I didn't mention that, but yeah.
Incredible. So definitely we look forward to having a greater discussion about that as we start our panel, particularly when it comes to the training aspect and communication skills. Before we do that, I'd like to actually start out with a question that's really around race equity. And I know that in the past few years, we've seen, especially in the past year and a half or so, past 2 years, we've seen a major focus underneath organizations to really embark on a journey to be racially inclusive. That is, embarking on this model to address systemic barriers that are actually existing within the organization. So, Brenda, I'd like for you to take a little bit of time and actually comment on your perspective overall in really helping us understand the key organizational parameters that are associated with embarking on a journey of racial equity. and any initiatives that currently are being run at your facility, and some of the initiatives that you're actually leading to ensure that the systemic barriers, the systemic racism, in fact, is a major issue that's being discussed at many organizations. And those major inequities are in fact being addressed at the highest level of the organization.
Well, Frank, that's a lot. To Paula's point, I could spend a whole hour talking about that. But let me try and bring it into what I can in the time that we have. So first of all, the one thing that I can say, since joining my organization, the structure that we have is a DE&I is a business imperative. It's just as important as patient safety.
So I'm just trying to hear. She's speaking.
So as it relates to how that's structured from the very top, so you take our current president and CEO of all our hospitals and universities has an executive cabinet. The Office of Diversity and Inclusion sits in the executive cabinet. So it is a strategic partner to the organization. And I actually operate as the ombuds person for the HR team, as well as our employees. I'm also responsible for all of our collective diversity, equity, and inclusion councils. I have all of the healthcare side, so all of the 13 acute hospitals, which equates to 5 divisions. And within those 5 divisions, my councils constitute membership upwards of about 25 people. So collectively, it's about 125 of a variety of professionals, from anywhere from EVS transport to radiation oncology doctors to surgeons, nurses, and everywhere in between that are represented on these councils. We have a solid structure that we're implementing where the councils have boots on the ground responsibilities for role modeling the behaviors. We have institutional training from a baseline perspective. We have a department within our Enterprise Office of Diversity that is totally dedicated to development and facilitation of training. We're adopting the adjunct faculty model to engage staff as it relates to training. And we're trying to pull them specifically from our councils. And the beauty of this model, and this is the thing that I like the most, and that I feel very privileged to be a part of its implementation, is that my chief diversity officer, when she first came, she came in May of last year, in knee deep in a pandemic, knee deep in social unrest. She had to quickly get an assessment of an organization where systemic racism was showing within this organization. And she had a very small and powerful team to do that. So the first thing that she did was wanted to acknowledge that we as an organization wanted to hear how people were feeling. So when you ask the one question about how do you address it in your organization, the first thing any organization I find, they're going to be successful by just being authentic and understanding people are feeling some kind of way about all of this and giving them an opportunity to talk about how they're feeling. So she embarked upon 1,000 conversations, which were in the space of called brave conversations. And these conversations took place where it wasn't about problem resolution. It was about listening. It was about allowing people to have a safe space to talk about what they were going through, what they were feeling, and giving the organization feedback on where they saw areas of opportunity for us to really address some of the things that were going on. And from that, she developed a blueprint and how we will function and operate. And this blueprint is focused to align with our mission, our vision, and values. So our organization's mission is we simply improve lives. That's what we do. That's why we exist. And we do that through a series of things, but our values center around making sure that we always put people first and that we're thinking boldly and we're thinking differently. And we're always going to act with purpose to do the right thing. So when we're talking about systemic racism and using those values as a yardstick upon which anything that we're doing is measured against, it makes it fairly easy to know how to manage the tasks that need to be managed and how to ensure that what we're doing remains focused on those things. So The second comment, in addition to acknowledging that people have feelings about all of this that's going on in the social world, because it's not only the pandemic and racism, it's having to homeschool children, it's having to disrupt your household to turn your kitchen into your home office. It's having your chihuahua barking like mine does sometimes in the background when I'm on a Zoom meeting, or a baby crying, right? These things everyone is dealing with right now. We're in a whole new world. So compassion, empathy, acknowledging that we're all in a new world, and realizing that we cannot expect to do business the way that we always have. We have to find a way to continue to keep our operations, whether it's healthcare, financial services, manufacturing, media. We have to keep our businesses afloat, but we just have to be more creative in how we do it. And we have to remember that at the end of the day, in order to get our processes to effectively work, we've got to make sure that we're meeting people where they need to be met so they can be present and do the work that we need them to do in a safe and a reliable way. Because at the end of the day, if people can't be present and healthy while they're at work, and again, regardless of industry or discipline, it's going to show through. It's going to show through in how we interact with each other. It's going to show through in how we interact with our customers, constituencies, patients. It's going to show. So recognizing that is vitally important. And then once you get the feedback, do something with it. Don't just collect the feedback and say, yes, we heard you, and go away and it dies on a vine. So another thing that my leader has done in this space is, upon collecting data, one immediate area of opportunity was education on stereotypes, unconscious bias, providing tools on how to overcome unconscious bias, identify it, giving managers, regular employees an opportunity to really acknowledge the fact that bias does exist. We all have biases, right? From the time we're born, we have these biases as the world begins to imprint on us. When we're in a nursery, we don't have a clue. But once we leave that nursery, the world begins to imprint. So these tools, we required all 35,000 of our employees to do 4 mandatory e-learning platforms. And this e-learning is underfoot now. And then we're also developing tools for leadership. So you cannot just take this work and expect you can do one training on unconscious bias and it's a done deal. This is a fluid process. It's a journey. And we also have to recognize that we're asking leaders to lead by example, but we also have to acknowledge that leaders too are feeling some kind of way about everything that's going on in this world. So we've got to get our leaders to feel comfortable with where they are and get them to develop the sensitivities necessary to lead their people and their teams, right? So acknowledge it, give people an opportunity to voice their concerns. Listen without trying to problem solve, but also listen for opportunity areas that the organization can actually respond to. And you have to be persistent, consistent with your responses and your actions. You can't say, okay, we heard these 5 things, we're going to respond once and go away. No, and repeat, message, communicate, remind people we're doing this particular training because we heard this through our brave conversations. We're doing this particular policy change or practice change because this was feedback we received. Here is feedback we received, that we acknowledge and understand it. This is something that we cannot do at this point in time. Be authentic and as transparent as you possibly can. People have a greater respect for that when you actually follow through, right? And then look at your partnerships again, relationships. You've got to acknowledge the fact that if people don't have the appropriate tools to build and sustain quality relationships, all organizations have that responsibility to ensure that they do, you know, because everything that we do, every interaction, customer, client, patient, does not matter. If the relationship between one person and another goes awry, then we've got a huge problem, right? So to answer your question, I know that's the long-winded way to answer it, but I think you set me up for that because I said that could be an hour discussion. But what I wanted to do was try and give you some steps through that. So, you know, partnering relationships with HR, I'm extremely conjoined as it relates to anything that they may get wind of. any what I call the isms, discrimination, anything. I immediately partner with HR partners with me. We pull in any other entities that are necessary to involve in those discussions, and we problem solve together. And then we, the Office of Diversity and Inclusion, if we have opportunities to do follow-up interventions, whether it's training, we do that as well.
Absolutely, Brenda. Thank you. And we understand the importance of collaborative efforts when it comes to diversity, equity, and inclusion space. So as I move forward in really from the point that were points that were actually made by you, Brenda, and now Paula, one of the things that I think can be helpful at times is for our audience and leaders in general to really understand what is a pragmatic model in ensuring that we understand what diversity, equity, and inclusion really means within an organization. I think a lot of our students at times, they hear of diversity, equity, and inclusion, but we don't really know what that means. So, and Brenda just provided us with a whole lot of information, which is great. So now for someone who's never worked in the organization before, who's never actually had an opportunity to collaborate with DEI leaders, so how would we categorize and really describe an organizational model of DEI?
Yeah, thank you, Frank. I think, and oftentimes I'll tell, folks will ask, and when we onboard new employees, oftentimes at orientation, it's their first sort of foray into diversity, equity, and inclusion. And oftentimes people think of it as about race and ethnicity. And while that's certainly a component of that, it's certainly not the only one. It's certainly looking at all of the differences, but also the similarities that we all bring to the table, whether it's gender, education, language, geography, where you live, education. So it's looking at all of those intersections that we all bring to the table. But inclusion is really leveraging them. So taking all of our collective differences and similarities and using them to really the best ability of an organization. So, for me working in a hospital, I always think about, our employees, right? We have they're our most precious resources, our employees, but thinking about how the folks that do the clinical work are important, but so are the folks that do non-clinical work. You need to really look at from the folks that are security guards, our food and nutrition, our environmental services, all of those individuals play an incredible and important role in ensuring the operations of the organization. So leveraging and acknowledging that we all are valued and everyone's role is valued and is important to the operations of the organization. But it's also really allowing everyone to come as their best self to work, and making sure that you are cultivating an environment, an organization where individuals can really be their true selves, whether it's expressing their identity as it relates to race and ethnicity, but gender and sexual orientation, all very important intersections. So I think it's not just about acknowledging the differences that everyone has, but celebrating the similarities, because at the end of the day, when you take a moment to pause and listen to everyone's story, you'll be surprised at how much more we have in common than we do that we actually don't have in common. So, allowing that and taking that moment to listen to someone's story and realizing that you may have a lot more aligned with that individual than what you may believe, but, leveraging all of that. And I think for us as an organization, not just at RWD Somerset, but throughout our entire healthcare system, we've really done a beautiful job of setting the tone for that from the beginning when our employees join our organization. And we have a really great forum when we do our large forum of orientation, where we bring over 400 to 500 new employees, where that's we set the tone and we let folks know that we won't tolerate, like Brenda said, the isms, right? We have no tolerance for that when it comes to not just our employees and our staff, but even also our patients. We've been very fortunate to roll out a great policy that's only been around for a couple of months. And I know we're one of very few healthcare systems that address this, but, talking about race at the bedside. And, unfortunately, we've had situations where patients want a different provider because they may not want a provider of a certain race or ethnicity. And we had to really take a look at ourselves as an organization and say, are we going to tolerate that? because healthcare, has been around forever. And we've always operated with a certain way. And sometimes that's not always the right way to do things, right? You have people say, well, that's how we've always done it. And maybe the way that we've always done it isn't the right way. So we had to take a look at our own policies and procedures and amend them, right? To align with the message that we're delivering to our employees. So if we're not, putting pen to paper, and if our policies and procedures don't align with the message that we're delivering, then, it really isn't, it's really not effective, and we can't actually implement things. So we implemented our policy around not tolerating requests for providers on the basis of any kind of criteria that you may have, whether it's race and ethnicity, gender, et cetera, where we wouldn't honor that. And for a lot of people, they think, well, the customer is always right, but maybe that's not the case, right? So we had to really take a look at that and amend it. So I'm very proud of that. I know Frank and others were very instrumental. Our Chief Diversity Officer, Trina Parks, under her leadership, we've been able to move that forward and even hold our own patients accountable. Because back to that piece that I mentioned before, if our staff isn't comfortable coming into the workplace, they can't be their best selves, they can't take care of our patients. So we have to also ensure that we are taking care of them in the best way possible, when they're coming into work. We spend a lot more time at work oftentimes than we do at home, especially now during the pandemic. So we have to take care of our own so we can deliver better patient care.
Great, absolutely. Thank you, Paula. And I think, from hearing you speak, one of the things that came to mind is really the number of initiatives that are all part of diversity, equity, and inclusion work. Think about the policy, working with HR, Brenda mentioned, and pay disparity. In fact, oftentimes we can analyze data to understand whether or not individuals are in fact being compensated equitably. Think about the collection of race, ethnicity, and language data at the point of entry for patients, to ensure that patients we can analyze, can run the reports and look at disparities and analyze various models to understand where we have disparities of care. So I think those are all key examples of diversity, equity, inclusion within an organizational setting. And so Adele, when I'm getting to you, and as I think about pay disparity as an example, and particularly when it comes to gender, we know that there's a lot of literature that has really demonstrated a great deal of disparity when it comes to pay for women as opposed to men, compared to men. And in fact, women of color are further discounted on the dollar. So what advice do you have for someone who may be going into the workforce, who has never, who may already have a professional position, but now they want to again to a position where they can compete and they can be comfortable, and they can feel that they're getting compensated equitably? What advice do you have for them in terms of promotion and ensuring that they are compensated and they feel respected, and they feel that the value that they're bringing to the team is in fact honored and appreciated?
Great question. Very loaded. A great question. So I'm going to try to be as succinct as possible. But I would say, and you mentioned the word value, I think it starts with knowing your value, right? Knowing your worth. First of all, be good, obviously, at what you do, and let others know it. Don't be afraid to, not about being a braggart, but allowing people to know how your skill sets are helpful to that department, how you have helped move the business forward or drive business, let's just say to a health system. In my case, when I was working for the health system, we were measured, we had certain metrics. Even obviously when I worked in pharma, that's even, they're looking at those numbers even more closely. So knowing your worth, knowing your numbers, if you're going into a negotiation situation, letting them know, listen, as a result of my work, I have been able to increase 30% as far as driving business, or whatever the metric is that they measure you by. Know it well. Branding yourself as a professional, right? It's a lot about what I talk about in my book. Some people see the cover of my book and they think it's about celebrities. It's not, because I use the word celebrity interchangeably with thought leader or subject matter expert. So it's about becoming that go-to person that people can rely on, right? Everyone always knows that one person at work that says, they say, hey, let's go over and ask Katie to run the events because she's really good at it. That's because Katie has let everyone know that this is one of her specialties. And it may not even be the role that she's in, but it just so happens that she has that talent that lies within her. And maybe she wants to move in that direction. So that's also a good thing if you're looking to pivot. If you're in one role and looking to pivot into another, let others know. And maybe it might look like volunteering in the beginning. So maybe volunteer to run a conference, maybe volunteer to run a workshop or to even speak at a workshop. Join committees, boards, networking. This is what we're doing here is great. We get to know people now virtually, meeting people and letting them know who you are. It's really about getting known and working hard, obviously, but also working smart and aligning yourself with the right people. Finding a mentor at work is also very helpful if you can, and someone that maybe has blazed that trail before you. And I also think it's important to master public speaking and communication skills. It will be very rare for one to arrive at a leadership position if one is shy as far as public speaking. And so getting a media trainer, that's what I do. I'm a media coach, I'm a marketing strategist. So being able to communicate your message is really, really important. So, if you're going in for the negotiation, ask for the money with confidence, right? So don't go in shy with your body language, all right? So think about what you want, think about what you need, think about what you want, ask for it with confidence, prepare yourself, and arm yourself with your accomplishments, your contributions, and like I said before, with your metrics, so that you have some information to kind of fall back on.
Sure. So on that same line of thought, and I think we'll now step back with you with our second question. As we think about thought leadership, and obviously having the background in marketing, and also having delivered training in diversity, equity, and inclusion. So how would you advise thought leaders, or first, how would you advise DEI leaders that are on this journey or who are embarking on this journey to become thought leaders or embrace the idea of thought leadership? And beyond that, what are some key strategic marketing models that can be adopted and really aligning those efforts with DEI initiatives? Because oftentimes we see that a lot of organizations, they're extremely influential and extremely impactful in their DEI initiatives, and yet their marketing efforts are still lack in many ways. So how can we leverage our marketing efforts to ensure that the equitable models that are being considered and implemented within the workforce do in fact are displayed for outsiders and also internally for our employees?
Fantastic. Good question. So I'll try to tackle the first one first. So you asked, how does a DEI leader become a thought leader, subject matter expert? So I would say, first of all, pick up my book, Celebrity Media Secrets. It's on Amazon. But we're actually going to give away a free copy at the end of this, so stay tuned. But there's a number of things. I have a 7-step methodology to becoming a thought leader or celebrity in your space. And then we can talk a little bit about the marketing, which is obviously a part of that. But I think the first thing to do is, obviously you should already know your material inside and out. So know it well, be well regarded. And then mindset is one of the first steps in becoming a thought leader. So preparing your mind for success, reading books on the subject matter, aligning with other thought leaders as well. And that mentorship also comes to mind. And, the second step in my book is message. So it is, what is the message that you'd like to convey? And, if you're on a job search, now I'm kind of speaking broadly, but if you're on a job search or networking event, this is for the students out there, what's your 30-second elevator pitch? But we should all have a 30-second elevator pitch. I gave you mine at the beginning, right? I'm Adele Wilson. I'm a media coach and marketing strategist. And I help entrepreneurs and professionals present with power, poise, and style on camera, get booked on TV and media, and become a celebrity in their industry. So always having that 30-second elevator pitch ready to go, not only just in case you meet someone interesting in the elevator, but also if you're in that networking event, if they're asking you to, Brenda or anyone else to comment on initiatives in the media. And by the way, the media doesn't typically give you a week's notice. They typically call you and they say, hey, can you make the, the 5 o'clock news? And you're like, oh my gosh, it's noon or it's 2 o'clock. So you have to have it all ready to go. And so you have to be prepared so that you don't have to get prepared, if you will. And so that's where media training comes into play. But so mindset, then message, I would say, I won't go through all 7 steps, but image and branding is really important as well. So, you know, what is your personal brand? So building your personal brand, you can build your personal brand even if you don't have your own company. So I feel like I've built my personal brand even when I was working in various companies. Personal brand is all about your reputation. What are you known for? By the way, if you're not happy with what you're known for, change it. That can happen as well. So how to build thought leadership? You have to get out there, especially now during the pandemic. We're doing a lot of this, a lot of Zooms. So presenting well on camera it doesn't always translate to being a strong public speaker in person. You need to understand also how to create your online presence. Is your LinkedIn on par? Right? Is your information there? If I were to go to your LinkedIn or your Instagram right now, I'll stick to LinkedIn a little bit more because that's more of a professional platform. But are you showcasing your abilities? Are you showcasing what you're doing? I posted about this on LinkedIn. And so it's important. You don't want to be, what you don't want to be is the best kept secret. You know, we know Frank, he's amazing, but nobody knows. And so, right. So writing a book is a part of that. That's, you know, most thought leaders have books, not all. You know, that's a great way to get your message concisely into one place, and then you can train to it. And, you know, when you're interviewed, you can go through the steps if you have a methodology. That's another way. And then obviously the distribution of your message. That's what we talk about as far as marketing. So where are you marketing? Are you doing the old-fashioned thing, sending out postcards? I would suggest doing Facebook Lives. LinkedIn also has capabilities as well, having a YouTube channel and networking. And if you can't do it in person, do it on a virtual platform. I think all of these things are really important, and capturing that momentum. You know, if somebody does call you from a news program, don't turn them down.
Right.
You know, actually take them up on it and take that as an opportunity to share your message and be able to try to share your message in under a minute or 2.
Right. No, thank you, Adele. I think that's just think about really a thought leader, the idea of being concise and being respected as a leader, particularly when it comes to DEI work, such a challenging work at times that oftentimes faces a lot of challenges and a lot of, I would say, ultimately, you have to be a key navigator and an excellent communicator, and having to navigate those various leaders. And the other thing I think that came to mind as we're speaking is really when you think about messaging, oftentimes as DEI leaders, we're called to provide input on so many messages that are all that have to deal with, you know, could be a national issue, could be something related to the state of New Jersey. I remember recently last year when with Mr. Floyd's incident, a number of key messaging from major companies had to be really tailored and ensure that the organization shows support for various groups within their institution. So marketing, communication, being able to be concise or key, extremely important when it comes to thought leadership in DEI. So as I transition into you, Paula, and as I think about some key accomplishments when it comes to Proud Family Health Center, and so what are some of the things that I think, as we think about a more granular approach, and what are some key accomplishments that you are very proud of as the leader of the Proud Center, and beyond that, what are some additional initiatives that are to be expected as elements of equitable patient care and outcomes?
Yeah, thank you, Frank, and I'll try to be concise as well. I know we're kind of getting, you know, want to leave room for questions, but I think for us, the primary driver of ensuring the success of our Proud Center is education. You know, the term cultural competency, gets kind of thrown around often in the DEI space, but it really does come down to that. and educating our staff. So all of our new hires have to take LGBTQ competency training upon hire. And I do that every year on an ongoing basis to ensure that you're keeping that conversation going. I think it might have been Brenda that said before, but this is not a one and done thing, right? It's a journey, and you have to really keep that conversation going. So for us, it's continuing that education to our staff to account, of course, for new hires, but also turnover within our workforce. So that's certainly a big accomplishment for us, is being able to train our staff on an ongoing basis when it comes to LGBTQ plus sensitivity. I would say the other major accomplishment as it relates to our Proud Center is continuing the expansion of our services. So this year we celebrated our 5th year. And in the last few years, our team has expanded. So we started with 1 patient and 1 provider. Now we have 3 providers, we have a patient navigator, and we have a whole cadre of services that we're continuing to add. Now we're looking at addressing the behavioral health component, because for the LGBTQ plus community, that is a very integral role in really holistically taking care of them. So having behavioral health care services available at our facility is really that next layer that we're sort of missing. And I would say the third thing would be allyship and support. Really, if you think about all of the different marginalized communities that have managed to sort of rise above their situation, whether it's the women's suffrage movement, other different groups that have been marginalized and have sort of come out of that, you've needed the help of allies, and the LGBTQ plus community is no different. So really engaging and galvanizing our leaders to kind of get behind the work that we're doing, and understanding why it's so important, and why it's meaningful, and why it's necessary. So allyship, I think, is a huge piece, really for any kind of DEI initiative, is having that support of allies to bring that message forward, especially when it comes to your leadership. For me, and I think others will agree, Adele and Brenda, that DEI is a top-down approach. It doesn't work when it's bottom up. You have to have the support and the engagement of at the highest level of your leadership to really cascade that message. So, I think those are the 3 major accomplishments for us from an LGBTQ perspective. I'm very fortunate to work for our CEO, Tony Cava, who has not only been an executive leader in this space, but has really pushed forth that we develop this program and continue to support it, not just from a public perspective, but also fiscally, and ensuring that we have that financial support behind to really move it forward, and ultimately provide the best care for a community that's otherwise been underserved.
Incredible. Thank you, Paula. And I think you actually answered one of the questions from our audience when it comes to really, does DNI, in fact, is it a top-down approach, from the top down to bottom up, right, or vice versa? The idea is that people are actually wondering about that and really want to know whether or not how do you actually embark on this journey. So I guess my last question, and really I want to make sure that I leave enough time. I see that we're running short on time, and then the last question I'll ask you, if you can provide us in a very concise way, next 2 minutes, is so for those that are actually considering perhaps a career in the space, and also for organizations that are considering adopting a similar model for diversity, equity, and inclusion within their practices, how would you advise that they in fact proceed with implementing such an initiative within their organization?
So I would say, for the individual who's trying to get into this space, you heard Adele say, look for volunteerism and look for opportunities. So if there are committees that are coming up, or people are trying to advocate for various things in this space where there may not be a formal strategy, get involved, ask questions, seek mentors in this space. I know for me, when I really started to formalize myself in this space, I went on LinkedIn and I started joining all these diversity networks and started talking to people and getting educated. So that's my advice to the individual who's interested. Plus, you can get academic, but the academic is often, it gives you principle, but it doesn't give you the practical application of that principle. So for the business itself, the very first thing they want to start with is just an assessment of their readiness. What is their cultural stance on where they are? And then, they should really do an inventory on what it is that they want to be and where does that align with their mission, vision, and values. And, one of the reasons why you have these best in class organizations, even, mine, our CEO, Dr. Stephen Klasko, is truly a visionary in healthcare as it relates to diversity, equity, and inclusion. He's written several books on inequities, healthcare disparities. He's very passionate, very committed about this work, which is why my boss, our Chief Diversity Officer, Lizette Martinez, sits in the executive cabinet, right? And this is why we're a strategic effort. But if you don't have that passion from the top, or you're not ready culturally from the top, then you're going to need to figure out what's your objective and then figure out the gaps and work towards filling and finding what you need to get to those gaps. But if you do have an organization that is ready and willing and just doesn't know how to enter this space, you can always seek external assistance from consulting organizations, look for hiring talent such as directors of diversity inclusion, diversity practitioners to come in and help formulate a plan, or you can do that with an external consulting team. But it all starts, first of all, with willingness, readiness, and those are the two key components for whether you're a large organization or a smaller. And remember, DEI is as vast as the Atlantic Ocean. And I would say, don't get tripped up and drowned in the ocean. Figure out your kiddie pool for your backyard and work on formulating what's in the kiddie pool, because you can get lost in the deep end, right? And so for me, that would be my advice.
Great, thank you so much, Brenda, and thank you to all of our panelists. We do have a question, and please, if you have a few minutes to spare, feel free to ask any questions in the chat box. There's a question that I'd like to ask of our panelists today. The question that was posed in the chat box is, how do you go about navigating a leader who's biased and, in fact, who really influences our promotion into the next phase and the next level? So what are some, as DEI practitioners and DEI leaders, what advice would you have for anyone who's actually facing such obstacles?
Well, I don't mind trying to take that one. Since I do have the HR background as well, I will say this, whenever there's a collision of belief between a subordinate and a leader, you always want to make sure that you validate whether or not that is a true collision and is it really a bias? And so you want to bring a third party to that discussion, and that third party is going to usually be your HR person. Now, if you're in a smaller organization and you don't have a formal human resources department, it might be a little more challenging because they act as an objective entity to help as a mediator in those discussions. So there are tools out there that you can pick up, things like Crucial Conversations and learning how to help you to have dialogue to make, these conversations come to light. You heard Adele say, know your value, know your worth, know your truth. And so if you know that you're deserving of a promotion and you are in a structured organization where you do have access to human resources, then you need to take all of those things to that discussion so that you can demonstrate it. And if you have clear examples of how this leader has treated you in a disparate or a discriminatory way because of X bias, you need to have that truth and documentation too, to help you further solidify your position. The problem with this type of thing is that you're going to have that proof.
Right.
But if you have the proof, the best thing always is to first work on the relationship between you and the leader, because you may think it's a bias, and it just may be that you and the leader communicate two very different ways. And so what you think is, he doesn't like me because I'm a woman of color. It may be, he's a bottom line communicator and I'm a detail throw up all over you communicator, and he doesn't want to hear anything I have to say past what he's gotten out of the conversation. And so again, I go back to where I started. Everything centers and jumps off from that relationship. And it could very well be just a fractured communication in that relationship that may not necessarily be a bias. On the other hand, though, it could be an intersectionality and compounded by bias. But you got to unpack that. Best thing to do is seek an objective person mainly HR to help you do that.
And thank you, Brenda. I think just a follow-up and last question before we close out. We did have a question from our students that really referenced to the idea of what happens when you actually new to the organization. As a new person within an entry-level position within your organization, and feeling that there's a lack of support, a lack of inclusionary practices, do you risk jeopardizing your position, or do you in fact take action and go in and really look to take on and find ways to have this inclusionary piece to ensure that you feel treated with respect and dignity?
I would, I'll tackle that one. I would say that, you know, depending on the size of your organization, right? I would look at the BRGs or the ERGs. A lot of companies, you know, have employee resource groups or business resource groups. That the terms are interchangeable depending on where you go, and look toward those groups. Oftentimes that's where you'll find your like-minded folks that perhaps you can bring those concerns forward and they can, you know, validate them, right? If that's the case, or at the very least, you can find individuals that you can speak to more comfortably. If those groups don't exist, and you know, form one. You know, be proactive and initiate it and start that. You know, be a thought. If you want to be a thought leader, be innovative and find ways to kind of craft solutions that you can bring that to the forefront of a conversation within your organization, and also really using your leadership. Typically, the ERG or BRG structures have the support of an executive leader. So try to cultivate and foster those relationships with some of your executive leaders, and use one of them to sort of lead a group. If you're gonna, you know, whether you're African American, Latino, a woman, you know, finding back to that allyship that I spoke about, finding an ally that can bring that initiative forth. So if you have the opportunity to bring that conversation, I would say start with the ERGs and BRGs to foster a more inclusive and welcoming environment.
Great point. Thank you, Paula. And I think the one key piece I'd like to add to that is really the idea that we have a number of affinity groups that go beyond race and ethnicity, such as veterans groups. There are, you know, obviously women groups and emerging leaders network. So there's a lot of ways that, you know, although you may not identify as a minority person, you may still have a great opportunity to be engaged and be part of various leadership or affinity groups to engage in diversity and inclusion. We do have an opportunity for Adele now. She has a giveaway for all of us. So, well, for someone in the audience. So Adele, would you like to give us more detail about that?
Well, I'm going to feel like Oprah used to back in the day when she had her show, because it's not just for one person, it's for everyone. So everyone in the audience, yes, everyone in the audience gets a free copy of my latest best-selling book, Celebrity Media Secrets. 7 simple steps to present with power, poise, and style on camera, get booked on TV and media, and become a celebrity in your industry. So all you need to do is grab your cell phone and you're going to text the word media, MEDIA 101 to 33777. So you're texting media 101 to the number 33777, and then you're simply going to follow the prompts and you'll receive a free copy in your email. Thank you, everyone. Thank you for the opportunity.
Incredible.
Oh, you're welcome, Kaylin.
Thank you. Thank you so much, everyone. I'd like to thank our panelists. I'd like to thank Adele for the books. We really appreciate your generosity and certainly look forward to reading the book. And at this time, I'd like to thank Brenda. I thank you, Paula. I thank Adele. I thank everyone. I thank Ashley Clark, who's been instrumental in ensuring that we have a successful event. Actually worked with members from Rutgers University to make this event possible today. I'm just showing up, but Ashley really did all the work. So Ashley, big shout out to you. Thank you so much for putting this together, and also thank you to the Nazi leadership team. At this particular time, I'd like to pass it on to Wendell, who's going to close us out. Thank you, everybody.
Thank you, Frank.
Thank you. Thanks so much.
Thank you so much for having us.
Yes, thank you for having us.
Panel, Brenda, Paula, and Adele, again, for your wonderful insight and information that we shared. I hope the students at Rutgers had something to take away from this. We want you all to continue to follow us on LinkedIn or your preferred social media platform. We have some other exciting talks coming up very soon. And again, I want to thank everyone for the time. Have a good evening.
Thank you.
Thank you,
Thank you.
everyone.
Thank you, everyone.
Take
Have a
care.
great night.
Have a great evening,
Bye.
everyone.
Good night,
Thank you.
everyone.
Great seeing you,
Bye.
Brenda, Paula, Adele.
Yeah.
Thank you,
All right,
Brenda.
see
Thank you,
Frank.
Paula. Thank you,
Adele,
Wendell.
nice to meet
Thanks,
you.
Adele.
Thank you
Thanks,
for the
Paula.
mug.
Thank you,
too.
Wendell.